Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, give us a like. We'd love to know what you think. So today, my guest is Lisa Dunlap. Lisa is a nurse practitioner, a transformation coach, a holistic healer. Welcome, Lisa.
Thank you for having me. It's such an honor. I appreciate this.
Well, thank you for being here. I do appreciate your time. So let's just jump right into this. Why are you a nurse? Who or what brought you into this profession?
Yeah, I was originally 20 years ago an herbalist and practicing holistic health in Seattle and learning ways to heal myself using Western and Eastern medicine. I kind of went on that journey in my 20s, and I had thought I would be a naturopath, but after I traveled to some third world countries, I realized, and I had done kind of studying some native medicine. I realized the world at that time, I hoped to be sort of a travel nurse, work with Doctors Without Borders. So I realized the world didn't need more like native herbal medicine. What we needed was kind of the integration of the two. And so I pivoted from wanting to be a naturopath and applied to nursing school as a second degree when I was 26. And I always knew the vision was nurse practitioner, but I wanted to take some steps to get there. And my vision was always to integrate Eastern and Western. I just didn't know what it looked like and how long it would take, like most journeys. Um, and so that's how why I wanted to become a nurse. And I got my training in Hawaii,
Okay.
which actually kind of fulfilled that need for wanting to work with people from all over the world and underserved populations. And so most of my nursing, my 5 years as an RN was 6 years, was visiting homeless on the beach and case management, outpatient. Um, that's where my heart was. And of course, teachers were not excited about that when I was in nursing school. They were kind of saying, you know, you're the kind of nurse that's going to fail because you're focusing on outpatient and holistic stuff. And I just knew in my heart that's where my gifts lay, was psych mental health outpatient.
Yeah.
Um,
That's interesting because as you were talking, I realized I was going to ask you, well, what kind of challenges did that present? Because I knew that in school you were going to get that pushback.
yeah, I mean, I was not the one acing all the tests. And so the teachers would pull me in the office and say, hey, it doesn't look like you're making it here because you're not passing our NCLEX prep tests or barely passing.
Mm-hmm,
But
mm-hmm.
in clinicals and with patients, I was fantastic. And I knew that. So there was some moments of doubt and I had to really go within to dig deep into my belief in myself and my vision. And I remember the best advice a friend gave me, a wiser older friend said, put your mission on the wall as you go through this journey, because people are going to try to put you in a box or a lane.
Mm-hmm,
And you need to
mm-hmm.
stick to this vision of holistic integration and knowing that when you get out, med surg is not necessarily med surg nursing going to help you with the skills to become a nurse practitioner. Um, Totally a valuable career, but I knew for me, I was like in tears in the bathroom on a med surg unit, not like, and I just knew there's so many roles.
Yeah, yeah,
And these teachers sometimes, bless them, also are limited in their view.
yeah.
And I kind of am grateful for that teacher who said, you'll never make it, because it made me want to push harder. And when I got my first high paying holistic nurse job in an inpatient setting, I remember just wanting to send him, you know, the job offer, the paycheck, and I didn't. But um yeah, so there's those moments, right, where you have to really look at your vision for
Yes.
yourself and your
Mm-hmm,
strengths.
mm-hmm, mm-hmm, mm-hmm. Absolutely. And one of the good and the bad things perhaps about this profession is that it is so wide. And sometimes we get lost in actually knowing what we would like to, because there's just so much to choose from. you know So it's good that you had that vision for yourself and was able to follow and to stick with it despite what anyone else might have thought about it.
Yeah. And I think just like most nurses, when you're new, you try different roles and you realize I am not like everyone else. This isn't a good fit. It's not that I'm a failure.
Yeah,
It's that this doesn't fit my life. I tried night nursing, weekends, holidays. I tried, and I tried some inpatient, and I just knew my strengths were going to be in more of an outpatient setting,
yeah,
and that my gifts were more, psych, mental health, primary care. But it took courage, right? Because the mentality of you better stay in a job for 2 years
yeah,
and job security. And,
yeah.
there's so many nursing jobs. There's
Yes,
such a variety. And so
yeah,
for me, I tried different ones to kind of figure out what was the ones that fed my soul, that I was good at, and fit into my lifestyle, right?
yeah, yeah, yeah. And so you became a geriatric nurse practitioner.
Yeah. So
Oh,
that's exactly a great segue, because I never imagined that I would focus on geriatrics. And I thought I would do women's health or private, just all ages. But
mhm,
I found in my NP school, so I was practicing as a nurse, doing my master's, luckily before kiddos, um, at the same time. And I found that holistic vision could really play out more in the geriatric world, because we could have 45 minutes with a patient, and we were taking away medications. And as we said in Hawaii, where I practiced much of my career, talk story. It was more about the connection, the hand on the hand. And sure, in any practice you can do that, but for 15-minute visits, I tried that and I was not thriving, and I did not feel I could give my patients the full breadth of
yeah,
what they needed.
mhm,
And so I think that geriatrics pulled me in that regard, because it was this more holistic approach. It was
yeah,
more talking about lifestyle, taking away meds, and doing less procedures,
yeah, yeah,
that type
yeah.
of thing.
I,
So
I
I got
fully understand what you're saying. I went from that acute care nurse, the adrenaline pumping kind of nurse into um by accident maybe segued into a longer term thing and found that I liked it. So I get exactly what you're saying. Yeah,
yeah, and I
it's
I
very
used
fulfilling.
yeah, and what I loved the most was house calls, actually, was because I loved autonomy and flexibility in my schedule. And so I ended up in a house calls geriatric practice as my one of my first NP jobs. It was challenging, but I loved it. Was like 4 patients a day, and I could stop and grab a coffee, or, go on a quick walk. There, I wasn't on someone else's schedule. And that really for me was like bingo. I like house calls, no matter what role, if it's hospice, geriatrics, case management. And I can go home and chart with my slippers on. And so I discovered that early on, and it just made me a better person, and then thus a better provider.
There you go. There you go. There you go. So a quick question. Is there anything about nursing life that you would like to see change?
Do you mean from a systems level or from a personal level?
Let's start with the systems level.
Oh boy. I mean, I think there's a lot of problems, we all know, because right now we're in this, culture of nurses, high turnover,
Mhm,
feeling
mhm.
underappreciated, and poor working conditions. It's
Yeah.
probably the one of the worst times it's ever been, except mine is
Mhm.
with like Florence Nightingale, when it was like the beginning and she was just
Mhm.
trying to create procedures and policies. But for me, what stands out is the hustle, like ego culture of it that starts in nursing school.
Mhm.
The like, you're a better nurse if you work overtime. You're a better nurse if you take those extra shifts. Let's brag about not sleeping. And it can start, it's probably trickling down from the doctors and the administration. And I just have found myself in so many of these conversations where you feel like the oddball if you're going to say, hey, I celebrate the fact that I don't take
I
overtime,
don't. Yes.
don't work weekends, and I don't take extra shifts. But there's this inner, like, I'm a bad nurse if I
Yeah.
do that and
Yeah.
say it and
Yeah.
celebrate it.
Yeah.
So what I try to empower women in healthcare with my coaching to do is to set the trend, to not feel guilty, to take PTO for mental health. It's not your problem that it's understaffed. It's your whole goal is to take care of you so you can show up and
Yeah.
to celebrate those vacations and those lunch breaks.
Yeah. Yes.
That
Indeed. Indeed. And to stop grabbing a donut when what you really need is,
Oh, girl, and just taking breaks. I mean, that's when I coach women. It's like, let's start with a 10-minute break at work and mindfully eating,
Yeah.
shifting from hustle, hustle, fight or flight, shoving a donut and a coffee to, I'm going to take some breaths and embrace whatever healthy food I brought, right?
Yeah. So you just mentioned that you're coaching women. I know you have a group, Burnout to Bliss.
Yeah,
Yeah.
yeah. I have
And
a
it's
fantastic
aimed
Facebook.
at women, at
Yeah.
females in healthcare, and I want to know why women.
So it's kind of a long story, so I'll try to keep it short. It's I'm a woman in healthcare. I'm a mother in healthcare, and it's really my target is nurses and nurse practitioners because that's the walk I've walked. But lots of interest from all women in healthcare. I want to be in the Facebook group, and there's tons of value. Um, my burnout journey was about 2 years ago, and when I pivoted from my full-time geriatric nurse practitioner role, I had a 2-year-old and a 5-year-old at home, and much like many people's story, the pandemic blew
Mhm.
up, right? And here I
Understood.
was in
Yeah.
King County, Seattle, the beginning where it all blew up, and that nursing home where nobody got out, and that was in my territory, the one where everyone was dying, and
Yeah.
they were throwing us. It felt like to the wolves. It wasn't anyone's fault, but it was like, oh, we don't have PPE. We don't really know about this virus. Keep doing your job. Go in and out of 5 nursing homes a day. Put yourself and your family at risk. And meanwhile, childcare was.
Yeah.
And
Yeah.
I just was already burnt out, which I didn't know, which many people don't know, because just in and of itself, being a working mother who's trying to maintain her career and going back to work when your newborn's 10 weeks old twice, you
Yeah.
can relate.
Yeah.
So, without sharing too much, I hit rock bottom mentally, physically, emotionally, and crawled my way back out. I realized I'm not alone. There's a lot of women, mothers and women who are carrying the burdens of caregiver of their parents, caregiver of their children, sometimes their husband, depending on how
Mhm.
much he does, and going to work, doing it all. And it was like
Mhm.
my burnout journey was to learn I don't have to do it all anymore. I'm a human, I'm worthy, even if I lay down and rest. And so I really felt this need to help women because yes, there's men and they might be burnout too, but I think it's also relatable. I can share my stories and women can relate
Yeah.
to the postpartum depression and the postpartum anxiety
Exactly.
and the things we have to push down to go to
Mhm.
work.
Mhm. 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 So you mentioned that you were burnt out, but you didn't even really know you were burned out. So do you think that there are signs? I know that there are signs that we miss, but what are some of them?
Love that question. That's a fantastic question because if you're watching
Mhm.
and you're like, I'm not burnout, I guarantee you there's symptoms and a continuum. I had this myth in my head that it was this like, I think in nursing school, all I remember learning is like, okay, if you're burnt out, nurses become drug addicts and have like a mental breakdown midlife crisis. And so that's what I imagined. So when I'm still highly functioning going to work,
Yeah.
those little red flags at the moment did not hit me. And what those were increased insomnia, increased irritability, increased drinking to just
Yeah.
soothe the
Yeah.
whole day, the whole week,
Mhm.
um, dreading going to work at a job I loved, total compassion fatigue. Here I am with dying hospice patients in pain. And I just remember thinking, if another patient complains about pain, and that's
Mhm.
terrible.
Yeah.
Another red flag that was very humbling for me was my boss calling me into his office a couple times at hospice and saying, there's some patient complaints that you're just checking off the boxes. You're not connecting. And I was like, whoa, because that was always what I was good at. And that's another symptom, sort of just disconnecting,
Mhm.
going through the motions. Um, for me, physical body symptoms, and I think that it's hard to understand until you go through it, but that was manifested as severe, debilitating back and hip pain,
Mhm.
sciatica, and then became, I had some trouble with this ovarian cyst. And then it was like a ball of fire. It just kept moving. And then it was GI issues, which I think are the most common, like reflux,
Yeah.
gastritis,
Yeah. Mhm.
IBS. Like those are symptoms of stress and burnout. And so all of those, looking back, had probably been going on for about 6 months prior to when I, like I said, crashed and burned, couldn't go to work, couldn't care for my kids, so much pain, so much debility that I had to go on disability. And that's when the healing journey began.
Mhm. 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 Yeah. When I realize that very often you think you're the only person who's feeling this, and as I speak to people, I realize that it's almost an epidemic within this profession. And so one of the things I wonder is how we just can't let this go on. How can we institutionally as well as personally um, put some things in place? I feel like institutions, for example, need to have some kind of policy or procedure or respite or something in place to address the fact that this is happening, and somehow put some kind of preventive measure in place to deal with the fact that your staff is just going to pieces.
Oh, I love this question. And I think you, having been on the side, you've been in some leadership roles, right?
Yeah. Yeah.
You probably have some answers better than mine. But for me, from the work I do on a personal level, then we can talk systems. I believe that the change has to start here. And the more we do self-compassion, self-acceptance of where we're at, allowing some of these emotions out, and then, and how I coach my women is daily practical self-nurture rituals that are you 5 minutes before your shift in your car, checking in.
Yeah.
How am I feeling?
Yeah.
What is something that I'm good at? How can I practice self-compassion right now? And what is one thing I'll do to nurture myself on this shift? Just one small thing, water breaks outside, and then, throughout the day, mindful moments, washing your hands, taking deep breaths, and noticing I am here. I hear things, I see things, I taste things, the five senses practice. And these sound minimal, but the thing is that they add up and they change your mindset, your
Yeah.
stress level, and they help reduce burnout. So that's what we can do to control ourselves.
Yeah.
And talking about it, getting anyone that helps you, coach, a therapist, and I run a group, and these nurses love it because they are like, "Oh my God, you're feeling this too?"
Yeah.
And so that is, asking for help. And on a systems level, I believe that there needs to be mandatory, CEU pieces that are about stress management and burnout. And these would be, you're paid by most organizations, paid work time to get these
Yeah.
continuing ed
Mhm.
credits. And there needs to be these trainings that the organization funds, for some coaches like us to come in and do mini workshops or 8-week group coaching. And that could be from the leadership down. It could start with leadership, management and then to the nurses themselves. And I think there's a lot of power in that, because then people would feel like they're definitely not alone and they're all on the same page when it
Right.
comes to what are we trying to do here.
Yeah.
So that's kind of the things I think about. I'm curious what types of things have you thought about?
Well, one of the things that I tried and I felt like worked even a little bit was to get people to get the people you serve, and I did this in a long-term care setting, to get the people you serve and their families to see you as not just a healthcare provider, but as a person. And so a couple of years running, I did this thing called Who Are You When You're Not at Work? And people came in with there were seamstresses and chefs and hairdressers and, all these other kinds of things that they did. And I had them bring stuff in, and we had a whole, big thing about what do you do, bringing samples of your stuff, bringing samples of your paintings that you do. And we got to see each other as bigger people, instead of in just this little narrow box of somebody providing care. We got to see them as grandmothers and, soloists in the choir in church and all of these kinds of things, which seemed to help the way that we related to each other.
Yeah.
Yeah.
I love that. And it of, human first, nurse second, and identity, because that's my burnout journey. So much of my identity was wrapped up in nursing, motherhood, exercise, and those were all taken from me overnight. And it was like, oh, well, who am I? And what is my worth? And a lot of nurses are overachievers. And I'm only speaking for myself and women that I talk to. I'm not sure, maybe the men too, but we tend to be the kind of people that, caring for others boosts us.
Yeah.
And
Yeah.
so that's where that inner work is, like that self-work and the boundary setting and the confidence building to say no to things, to set better boundaries, to feel like you're a beautiful human at the end of the day, even if you make mistakes.
Yeah.
Mainly, I'm not yet at the systems level of creating change. I'm mostly helping nurses feel more empowered and that, to control what they can,
Yeah.
right?
Mm-hmm.
And over time, I feel like when we work here, it's a ripple effect because people feel it, they see it, they want it, and then you have more to give to the community, to your patients, and on it to start making some system level changes.
Yeah.
I do offer trainings for healthcare organizations, and I've done a couple. And I think the challenge there is the staffing. It's not really the funding, but it's there. It's like, how can we train our staff? We want this burnout and resilience training, but how can we pull staff from the floor? And we have no staff to replace it. And so that's where it's the creative, like, okay, paid time outside of work to do your CEU, or maybe it's 10 minutes in every meeting.
Right. Doesn't
You
have to
have
be a whole lot of time.
a mini training, or maybe it comes in your email. Every email they send out has this mini mindful self-nurture moment, or, so there's got to be a lot more creative ways, for this to change.
Yeah. 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 I absolutely agree. I absolutely agree. So, what advice would you have for someone who wants to be a nurse? What words of inspiration?
I would just say follow your gut and your heart. Do the things that the skills you need to be the kind of nurse you want to be. And for me, my love was holistic. I got certifications in energy healing, mindfulness, clinical aromatherapy, herbalist certifications. I didn't always know how and when they would integrate, right? So that's part of the journey that you have to. And I felt comfortable talking to my managers about, hey, can I, talk about aromatherapy or healing touch with my patients? And I always made sure it was okay. And those were my gifts that healed me. So then I could really share them with patients.
Yeah. Yeah.
And then now my greatest love is self-compassion work. And some of these are so not contradictory. You can teach a mini mindful moment to a patient, deep breathing together. It takes 3 minutes. So I'm getting kind of sidetracked from your question, but essentially figuring out what feeds you and how your gifts will be highlighted. And if you're sitting in a job and you feel stuck, unhappy, hopeless, you're comparing yourself, I'm not as good, I'm not as efficient. Really look at, is this the right job? And recognize there are so many jobs
Yeah.
and you could thrive somewhere else. And it is easier than you think. I've had clients be so afraid to quit without a job lined up, and we work on more of a manifesting mindset, envisioning things. Literally, a couple of my clients within 3 days after quitting, not that I encourage them to quit, but we get to that through their values and visions. Jobs appeared and they were in a new
Yeah.
job, their dream
Mhm.
job within like 2 weeks.
Yeah.
It's amazing when you identify what you want and you decide you're going to get it, that it actually,
You.
God, universe. Yeah.
It actually comes to you. Yes,
Mhm.
indeed. So I want to know, I've been collecting these words, Lisa. What would you say is, if you could do it in one word, what would you say is the most essential quality of a nurse?
Great question. I mean, because of my current journey, I think it's self-compassion.
Compassion. Okay.
Yeah. Because in order to continue to give, we have to give to ourselves. And it doesn't have to be grand acts, but it can be many moments of mindfulness, stepping in nature, connecting with your spiritual source. What I learned was I was giving too much because I thought a good nurse was the one who gave and gave and gave and gave. And I pushed to do more. And in the end,
Yeah. Yeah.
that cooked me. So when we can feel compassion for ourselves, then we have a lot more compassion for others and even the system at times, right? Because if we feel victimized, that's not going to get us anywhere. But if we can understand that these things trickle down from the top and it's taken years to get here, it's going to take some years to get where we want it to be. So I think that self-acceptance is just so powerful.
Yeah. 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 And there's something else I wanted to ask. I've been feeling. We as you talked about, give, give, give. That is what we do, but we don't allow the people we're taking care of to give back to us. And you know, very often they do have something to give back to us. They do have something to teach, but we never seem to be open enough. We're so busy giving too that we never seem to be open enough to receive anything. And I think that that's one of the things that we probably need to, I don't know if you can teach it, but you can actually make someone aware of the fact that, you know, it can be a two-way street. Yeah, this is your job to do this and to do that, and that's who you are, but it can be a two-way street. And it's one of the things that can help you to grow.
Oh, I couldn't agree more. And I have, that's interesting because naturally for me, that's always been the case. It's one of the reasons I loved some work in oncology and mental health, and also because those are very resilient folks, and geriatrics, because they have so much wisdom. And
Mm-hmm.
for me, it gave me meaning and purpose to go to work and listen to my patients' stories and wisdom, you know, if they'd been married 50 years or
Mm-hmm.
they're beating stage 4 brain cancer. That type of wisdom and their stories gave me joy. And so that's one of the reasons I thrived in a lot of stressful positions. And I think, you know, one of the key things about burnout risk factors is not finding meaning in your work. And so if you want to find meaning, exactly what you said,
Mm-hmm.
talking, listening, and believe me, most patients want connection from you more than anything.
Yes.
That's it. I mean, somewhat touch on the hand, but a lot of it is the human connection.
Mm-hmm.
And I've had so many patients give to me that when you mentioned that, I thought, oh, that's interesting because you know, there's those boundaries, right? So
Yeah.
physical gifts, okay, maybe not, but
Right.
the
No.
conversations, the wisdom, their compassion.
Yeah. Yeah. Yeah, absolutely, absolutely. Um, I remember one of my biggest moments with that, and you know, I still get chills when I think about it. Was many years ago when I had a patient who was actually dying. He had a very aggressive glioblastoma and was actually in his last few hours, and his family was there and all of that. And while he could still speak, he wanted to actively thank staff in his, in his dying moments. He was actually thinking of other people and what they had done for him and how it made him feel during this time of his. And to me, it was like, it was so huge. I felt I was in the room when he actually died. And for me, that was one of the greatest honors of my life, just to be there when he actually passed away. So
That's magic.
yeah.
Yeah. And that gratitude, they know that neuroscience tells us that focusing on the good, even when a toxic work environment, even in a bad system, and you're exhausted, can create new neural pathways and hormones that make you feel good.
Yeah.
So he probably meant it from his heart, but it also probably brought him the most joy.
Exactly. Mm-hmm. Mm-hmm. Mm-hmm.
Yeah, that's a great lesson.
Yeah. Yeah, it taught me a lot, I have to tell you. It taught me a lot. I think there was something else I wanted to ask you, and I forgot what it is. Nurse Your Soul. Nurse Your Soul. How did you come up with this name?
So when I developed that ovarian cyst in the middle of the pandemic, solid grapefruit mass, they told me, and they didn't know if it was, the silent killer, ovarian cancer. And doctors were shutting doors, and it was crazy. They were saving all things for COVID, and I'm sitting there, and I really went down the rabbit hole of my mind working against me. I had panic attacks, metastasizing. I felt pain everywhere. I couldn't breathe. I thought, oh my God. And I knew that it kills quickly, and so I had so much more life left to live. So I went down that path. And then as I waited for answers, I made that choice. It was this awakening moment. It was a spiritual, it was a mental, physical, and emotional experience. It was, if this is your final days, do you want to live them in fear and worry and depression, or do you want to enjoy each moment?
Yeah.
It was that simple. It sounds corny, but it was real. And I, in that moment, shifted 40 years of patterning up until that point of negativity in my mind to, how can I find joy in this moment? What can I do to nurture me and my soul?
Yeah.
And sometimes that looked like bare feet in the grass first thing in the morning for 2 minutes. I had a toddler and a 5-year-old, and I was in pain. So it wasn't like these grand acts. Sometimes, because I was lucky and I was on disability, not working, I would every day at noon go to my yoga mat. Now, the old me would push myself to do a yoga class because that's what was healthy. The new me listened. Some days it was laying flat for 30 minutes. Some days it was a guided self-compassion practice. Some days it was envisioning this cyst dissipating and healthy cells. Some days it was crying on the phone with my deepest friends. And it was a ritual that I made every day. And I called out to a community to believe and to manifest this cyst going away and healing. And through all of that, in this 8-week journey of waiting for answers and then surgery, they went in for surgery, and there was nothing there. There was no cyst. There was no mass. There was not an imprint. The cancer test came back negative from before. And they were in awe. And they came out and I said, did you remove my ovary? Did you remove my cyst? And they said, no, because I'm like, why did I just have surgery? And she's like, because we didn't know. And so this, whatever you want to call it, medical miracle, spontaneous healing, for me, showed me that healing is truly a mind, body, spirit approach. And what I had been doing for that 8 weeks was nursing my soul. I was doing moments of self-nurture. I was asking myself, probably for the first time in my life, what do I need in this moment? Not like, what do I need in a month? What do I need, like a pedicure? Like, right now, what am I feeling and what do I need? Oh, I'm angry. I'm going to go outside and I'm going to take a baseball bat to a tree. I look crazy, but I don't care. I need to cry, tell my husband I need 5 minutes. And so these types of things were so powerful in my belief. That's why the cyst went away. That's why my pain went away. And I just knew that others could make themselves sick and others could make themselves well. And again, I was also using Western and Eastern medicine. It wasn't just all me. Um, but I just knew that I had to help women in my shoes, walking my walk, learn how to nurse their own soul. And for everyone, that's different, right? It's not going to be the same recipe, but we use mindfulness, self-compassion practices, energy work, aromatherapy, imagery, whatever they need in a coaching session. So it's healing and coaching. And it's really about empowering women to feel like they can do that and that it's okay to nurture yourself. And it's not indulgent.
It's not indulgent. It's not indulgent. Well, I have to tell you that I believe in balance. And you just said something that really resonated with me because you said others can make themselves sick and others can make themselves well. And we all know, I think, that we can make ourselves sick. But a good many of us don't seem to realize that if we can make ourselves sick, we can also make ourselves well.
I mean, it gives me chills. I've spent a life with diagnosed clinical depression and anxiety, and I've managed it in the ways that I can. But the best shift in the last 2 years has been the mindset shift to help me find joy amidst pain. And a lot of that is accepting the darkness and not trying to change it anymore. It's like, hey, depression is depression. I have a bad day. I'm going to just relax, roll with it. I'm not trying to change it. I'm okay. And it's my superpower because it makes me more empathetic and more like understanding, and anxiety makes me do pre-plan. And, so I celebrate these superpowers. And everybody has the ability to heal. And sometimes that's the inner knowing of who to reach out to help you heal, right? It's not like healers, it's the asking for help. It's the knowing when you need to rest.
Yeah.
And really feeling good about yourself, even if you are experiencing these things that society says, oh, we should feel ashamed about.
I know.
Yeah.
Lisa, on that note, thank you so very, very, very much for talking with me today. I really appreciated your time and enjoyed talking to you. Have a wonderful, wonderful day. Thank you so much.
Yeah, I'd love to share where folks can find me if that's okay.
Absolutely, absolutely. Thank you for reminding me. I intended to. Yeah.
Thank you for having me. This platform is beautiful and wonderful, and I can't wait to watch more of it. What an opportunity for nurses. Take advantage of this free resource, everyone. And if you want to join my free Facebook group, I welcome you. It's for any women in healthcare. It's called Burnout to Bliss for females in healthcare. Or you can follow me on Instagram and Facebook at Nurse Your Soul with Lisa. And you get lots of free value content. And you can always book a free session with me to see if it's the right fit, if you're just feeling stuck and you want to find ways to get unstuck.
Awesome. That is really awesome. These are all resources that we really, really need so much.
Yeah. Thank you for having me. And I really appreciate this opportunity.
Thank you, Lisa. Thank you very much.